I think the biggest thing the pandemic resulted in is a change in provider attitude and devotion to work. I think we've all heard about the burnout issues. It's become more acute now that we're seeing the retirements, we're seeing transitions of people from the clinical side to the non-clinical side. I think it's really important that we're aware of those feelings of our providers, to provide them the resources so they can do the work that they really went into the profession to do. You know, doctors want to take care of patients, nurses want to take care of patients. So we need to provide them all the resources in the background to allow them to do that. I'm on the utilization review side of the world. And from my view, working with clients, their biggest frustration is with the payers. It's sad because, again, we all want to do what's best for the patient. But oftentimes there's the perception that payers are in it for the profit and we're in it for the patient, and those two just don't necessarily mesh. So I think understanding each other's perspective is really important. Again, we want to provide great care to our patients. The payers also want their patients to get great care. Healthcare is always changing. There are new treatments, there are new devices, and I think it's important for hospitals to put in perspective what they're starting to do for their patients that's new. I'll give you an example. A couple of weeks ago, I received 2 calls from hospitals who were having difficulty getting paid for a stenting procedure that was performed in their hospital. What happened, these patients had come in with strokes, and the interventional radiologist went ahead and feed a catheter up into their brain. In this case, they opened up a occluded blood vessel and put in a stent. When they submitted the claims for these stents, they were denied. Turns out, if you look at the medical literature, stenting within the intracranial blood vessels is still an experimental procedure. So what had happened is that in this hospital, the physicians had adopted a new procedure that had not really gone through a vetting process to make sure that it was appropriate to be done on patients, that the right indications were in place, that the right consent by the patient was in place, and that the hospital would be paid for that procedure. So I think, putting in those hard stops when things are going to be done is really important. Get a committee together to review the new procedure. What is the insurance coverage? What are the training requirements? What are the consent procedures? Are there any compliance issues? There's a learning curve. And how do we adjust for that learning curve? Is it appropriate to let a physician start a new procedure that doesn't have the proper oversight and know that they have the right training? So we need to make sure, again, that as we do new things, that we're doing the right things for the right patients and getting paid for them. I think one of the most important things is to have physicians who serve in administrative roles to serve as a conduit between the medical staff and the administrative staff. In my world, those are physician advisors, right? Their job is to keep abreast of the regulatory changes, to keep the medical staff informed and educated, to make sure administration understands that there are new rules that have to be followed. I have a philosophy about clinical documentation in that what really matters is the patient. Right? At 2 in the morning, you have a hospitalized patient, and the doctor who's in the house kind of covering for all their colleagues doesn't know that patient. And when something goes wrong and they're called to the bedside, they need complete, comprehensive, accurate documentation to provide the best care possible for that patient. So when I talk to physicians, I stress there's a patient behind every single note that you write. And if you leave off a diagnosis, if you copy something from a previous note that is no longer accurate, if your thought process is not down in the medical record, that physician can't properly take care of your patient. So keeping that in mind is crucial. For me, being a partner with our clients means not just providing them the piecework that they're expecting, processing a claim, collecting a payment, coding a bill, but also being there for all their potential other needs. So on the physician advisory side, we do a lot of item work where we're looking at a chart, providing a recommendation. But I am so fortunate that in my role, I can be that partner for every one of our clients. They know that if they have a weird regulatory question, they can email me and I'll either have the answer for them or I'll research it and get them the answer. Oftentimes they have nowhere else to turn. So that's, to me, is partnership, is adding those extra services that you have expertise in that they can benefit from.